Okay. All right. Well, hello, everybody. My name is Eric Hollander, and I'm here at Spectrum Neuroscience and Treatment Institute. And I have the privilege today of interviewing Professor Lynne Drummond, who's an internationally known psychiatrist and researcher who's an expert in hoarding disorder, as well as obsessive compulsive disorder and obsessive compulsive related disorders. And Lynne is honorary consultant psychiatrist at Southwest London and St. George NHS Trust. She's a visiting professor at University of Hertfordshire. She's played an important role in the International College of Obsessive Compulsive Spectrum Disorders, or ICOX, for many, many years. And she's the author now of this new book called Everything You Need to Know About Hoarding, which also features self-help chapters. And this has just come out from Cambridge University Press. Now, hoarding is very much in the news. This morning, I was reading about Judd Apatow. He's the director of the 40-Year-Old Virgin. And he came out of the closet and said, well, he's been a hoarder all his life. He's held on to things since childhood, and he holds on to all kinds of books and reading material. He feels that he holds on to these things because he has a fear of death. And that if he's got all these books that he still has to read, he can't possibly die because he still has to be able to read these things.
Yes.
So tell us a little bit about the definition of hoarding. What is exactly hoarding disorder?
Well, I think that hoarding itself is a symptom rather than just hoarding disorder. So you can get hoarding for a whole range of reasons. But for somebody to hoard, they have to have a problem either with acquisition or with sorting of objects or with disposal of objects. And often they have a difficulty in all three. So, for example, if you had a difficulty with acquisition, you pick up a lot of things. You might people with kleptomania or some people with ASD. I'm sure you see that, Eric. If you get people that have difficulty in classifying, of course, we often think of people with dementia and that being a problem, and hoarding going along with that. And then and also people with ADHD who can't concentrate and sort. And then for disposal, it's often because of attachment. You see that in people that have had deprived upbringings. And you also see it in people with OCD and OC spectrum disorders and a range of conditions. Then we've got hoarding disorder, which, as you know, was defined by DSM 5 in 2013 or ICD 11 in 2018. And that is a new disorder that was defined at that time. And that's a big move forward. But I still think actually we haven't really honed it down, and there are still some overlaps. But hoarding disorder is defined as collecting more things than are useful to you in your environment and living in a mess, and you might have extreme difficulty in getting rid of these items. Of course, in the past, it was always subsumed as being part of obsessive compulsive disorder or obsessive compulsive personality. So I think we're going to be seeing better understanding as the years go on.
Right. Now, there are plenty of individuals who are collectors, right? So
Yeah.
I've been to the Frick Museum and the Barnes Museum, and these people have had amazing collections of art. So what's the difference between a collector and a hoarder?
I think in a collection is normally organized in some way. I always give an example of a gentleman I saw many, many years ago who was actually very, very educated man who knew all about every film or movie that was coming out, and could review and critique every movie. And what he did every day was he went out and bought every broadsheet newspaper, and collected it. And by the time I saw him, he had multiple lockups. His house was full. He was in financial difficulties. And when we started to talk to him about moving these newspapers, which of course were rotting, etc., he said that they're a valuable collection. But in reality, they weren't a valuable collection. They were a pile of old rotting newspapers. For a collection, he would have taken out the reviews, maybe he would have filed them, he would be able to find them. Whereas where it was, if you said to him, where's the review of X movie, he wouldn't be able to find it. And I also remember in England, there's a property that you can visit, a big old stately home called Cork. And you go in there, and it was given to the country, I can't remember when, about 2000, by the family. And it was left in the way it had been for the previous 100 years, with wallpaper the same. And when you go in, there is these amazing big display cabinets, mahogany display cabinets. And the lady that was showing everyone around said, oh, of course, the laird, or the past lord, was a great collector, naturalist. Well, what you actually saw in these cabinets was not a collection. It was bits of shells, feathers, skulls, meshed seashell, all piled into one cabinet in a haphazard manner. And these were really beautiful mahogany cabinets, but what you saw was not a collection, it was a hoard. And of course, he hadn't been recognized as being a hoarder because he had a 30-bedroom mansion. Whereas if you're living in a one-bedroom apartment, you would fall into trouble much sooner.
Right. Now, you mentioned the kind of systematic method, right? So I guess people who have autism are kind of systemizers, right? They organize things into systems. So maybe you can say a little bit about the relationship between hoarding and or hoarding disorder and autism spectrum disorder.
Yeah, I went through all the symptoms on the stated symptoms on DSM-5 for autism, for obsessive compulsive personality, and for hoarding disorder. And there is a massive overlap between the two. I think that's what I'm really saying about us not fully understanding how these link into each other. Of course, people with ADHD, we know that that actually about over a third of people with ADHD also have hoarding. I'm not aware, you may be more aware, Eric, if there are any studies on people with ASD, but certainly there are huge overlaps in some of the symptoms and signs.
Right. And with ADHD, I guess individuals can have issues in terms of sort of processing information, and they procrastinate. So they tend to, throw things on a pile and say they'll get to it later.
Yeah.
But then they don't get to
Never get around to it. Yeah.
Tell me about the executive function issues that may be present in patients who have hoarding disorder.
Well, that goes back, doesn't it, to the processing and to the working out of what is important, what you need to do next. I mean, I think that's typified, isn't it, by ADHD, when you're getting so bombarded you can't organize things in order of priority. And I think that is really important in developing the hoarding in those cases. I don't think it's universal, though. I think that some people, maybe the kind of people that you see that have often deprived childhoods, either emotionally or in terms of access to physical comforts, they become extremely attached to the things around them and hoard them. And in a way, you can understand that as well. As that is a universal experience that, well, it's a bit like, even in the animal kingdom, a squirrel storing up nuts for the winter and storing up more than they need. As human beings, we do tend to store things, but in people that have had a deprived background, they have more of this. And I think one of the problems is that by lumping everything into this umbrella called of hoarding, we're not looking at what the individual differences may be. And so we'll find these abnormalities in executive functioning, but it may just be one group that's skewing the whole lot.
And that's really fascinating that individuals with hoarding have higher rates of, I guess, deprivation early in their life, right? And so they want to hold on to things because they feel deprived. I guess it raises the issue of nature versus nurture. So is hoarding a genetic disorder, or is it an environmental disorder? Is it a complex mix?
I think, like most conditions, it's going to be a complex mix, isn't it? Certainly, we know that with OCD, we thought, oh, we'll find, these genetic links, and it's all going to be simple, and it actually works out as being far more complicated than anyone ever believed. And of course, that's not really surprising, because I think what I'm saying is that at the moment, all we see is the end result, and we don't know what goes into making that person have the condition. So it's probably going to be a complex mix of genetics, of environment, of learning, and also possibly of traumatic events at different stages in the life cycle.
So tell me more about that relationship between trauma and the development of hoarding.
Well, there's not an awful lot of work, full stop, on hoarding, to be honest. But certainly some studies have suggested that people that have gone through trauma are more likely to cling on to physical possessions, and that can, whether that goes into hoarding or not, I suspect that's where all the other factors come in. I mean, for sure, I'm old enough that I was brought up at the end in the UK of rationing during a time when people had gone through quite a lot of privation during the war. And I think anyone of my generation brought up then was always taught, make do and mend. You don't throw items away, you collect. And I think that a lot of people of my age have had that instilled in us from quite an early age. I suspect now that that's happening much less often.
Right.
And we seem to be in a throwaway society. And I certainly know that if I'm about to throw something away, I think about it 2 or 3 times to make sure that there's not some better use I can put it to, because I think it's been instilled in us.
Right. No, it's interesting because, certainly in this world, many individuals are brought up in a state of like overabundance, I guess, right? And so we have higher rates of obesity, for example, as opposed to like underweight associated with like food instability or starvation. Does that mean that in situations where there's overabundance, that there's lower rates of hoarding?
I don't think anyone can really answer that yet. I think the whole problem with hoarding is because it's only been defined fairly recently. And I don't need to tell you that of all mental conditions, obsessive compulsive and related disorders tends to get a smaller share of the research monies and that they deserve, considering the seriousness of these conditions. And hoarding has been particularly, I think, stigmatized because It, it, I'm sure in the UK and I'm sure in America there have been programs which have tended to stigmatize people with hoarding further. People with hoarding are aware that they are often viewed as being dirty, lazy, unpleasant, somehow immoral individuals. And even in mental health settings, all too often I've heard, oh, these are not people that have got mental health real problems. It's a lifestyle choice. And way back in 1996, I went to publish a paper looking at hoarding, and I had a tremendous problem getting anyone to take it seriously and to actually publish it. I did eventually, but I was told time and time again, this is not a mental health problem that you're describing. So I think all of that is added up to the fact that we haven't got, to be truthful, we haven't got the information we need. And that was really one of the reasons why I wrote the book, was to actually raise the awareness of that and to say, hey guys, this is not something that is a lifestyle choice. It's a serious mental condition. It has a very high mortality, because we know that almost a quarter of people with significant hoarding attempt suicide. We also know that there's a high risk of death by fire caused by hoarding. In London, which has a population of 8 million, in 2022, the London Fire Brigade reported over 3,000 fires due to hoarding, which resulted in 186 injuries and 10 deaths. And that's just in 1 year in a population of 8 million. Now then, if you think of a country the size of the US and double that up at the same, and there's no reason to suggest it would be less, that's a significant number. Then there's the risk of trips and falls, and then there's the risk of infections from rotting stuff that can often be hoarded as well. And then on top of that, rather like in OCD, there've recently been studies to show that these are people that are more likely to have cardiac problems, respiratory problems from the hoard, and things like sleep apnea. Now then, those are the cardiac, the breathing problems are maybe more understandable with dust and dirt and stuff, but for the others, this is interesting. As I say, it's something that we see in OCD as well, and I suspect it goes in with probably some degree of self-neglect and poor diet, but I can't prove that.
So you've raised issues around stigma and shame, I guess, that interferes with people accessing treatment, but you've raised the issue of significantly increased risk, both for the individuals with hoarders and also for the people around them as well. So
absolutely, yeah.
So maybe you can tell me a little about some of the legal issues associated with hoarding.
Well, I think it's quite difficult because obviously our legal systems are a bit different. But overall, and I think looking at all countries, there's obviously the mental health legal provision. And generally, if somebody is a danger to themselves or others due to a mental disorder, in most countries, that means that the authorities can come in and step in to help with that. Otherwise, local authorities with us or departments can come in if other people are at risk. And I think this is much more likely to happen. As again, you're much more likely to be noted in that case if you're in a rented property or a property produced by the local authority than if you're in your own private house. So I think that can be an issue. Obviously, if there are children there, then there are separate laws to protect children from the effect of a parent or somebody's hoarding. Also, there are acts on pest control that again tend to be local authorities, and some people do hoard animals, and in those cases there are animal charities which will have the rights to come in and deal with this. So they do vary, and it's quite a complex amount of legalese all around it. And obviously they differ from place to place.
And you do hear about these cases of individuals who have all kinds of animals that they've collected and held onto and have possession of.
That's right.
Yeah. Now, tell us a little about treatment approaches, both psychological treatments and medication treatments for hoarding.
Yeah. Well, once again, I have to say that in general, there's not enough studies that look at this. With hoarding disorder being one of the obsessive compulsive spectrum disorders, people usually think of the antidepressant drugs of serotonin reuptake inhibiting drugs. And the research on that is a bit mixed. But we know recently in India, a doctor called Professor Saxena has always been saying that highish dose like you use in OCD of an SSRI can be helpful. And more recently, Professor Brakulius in Australia has shown that they're useful in up to 50% of people with hoarding disorder. We also know, but this is not from a proper controlled trials, this is from really case reports and looking that a drug called venlafaxine, which in general is not useful in OCD, may be useful in people with hoarding disorders. And that's probably well worth a trial because it's very well tolerated and a safe drug. So that's probably worth a go in hoarding disorders. Then with people that maybe have more of the ADHD, there's evidence that treating that with drugs like methylphenidate may be useful. And then there's a range of other things that have been suggested, but their case histories and things like I can never say it, you know what I'm trying to say.
Atomoxetine.
That's it. That's what I'm trying to say. I'm sorry. I haven't got my false teeth in today, I think. They're all useful. When we come down to psychological treatment, the treatment that's been studied the most is CBT. The standard of most of these studies, it's not high, and then they often use waiting list controls, which mean that they're not really good, high quality studies. So again, the studies are mixed. I think there's good evidence for a pragmatic approach. And one of the first things I would always do when seeing somebody, if I was treating them psychologically, is get them to agree that they're not going to bring anything more into the house while they're being treated. And I think that's essential, because otherwise it's like trying to get the water out of a boat with a hole in it, using a teaspoon rather than anything else. So to get there, I think there's good evidence overall, or some evidence, that group treatment, if you can get people to come together, is better, because somebody else with hoarding will call out the person, and also these people have often isolated themselves and feel the shame, so to be with a group is good. And then it's a matter of making sure that they have the skills to actually do the sorting and to prioritize what they need to get rid of. And you would do that getting them to stick to one specific area in their home. Obviously, if there are health and safety risks, you have to start there. Otherwise, you get people to start in one area with the idea that you start to clear there, because if they're flitting from room to room to room, they won't see the difference and won't see the result. And then you get them to decide whether the items are going to be thrown away, recycled, or kept. It's very important that very soon after doing this, they understand that once a decision is made, it's made, there's no going back, and it's much easier if those items are removed immediately from the property, because otherwise the temptation of going back and taking it all out and undoing all the hard work is very high. It's a painstaking process. It takes place over a long, long time. But as people start to learn how to make those decisions, and they start to feel the benefit and feel proud of their home again, then you hope that that's going to encourage them to continue.
Okay. Well, this has been a really fascinating discussion. I'm here with Lynne Drummond. She's the author of the new book, Everything You Need to Know About Hoarding by Cambridge University Press. And this is really a fascinating topic on hoarding. My name is Eric Hollander. I'm professor of psychiatry at Albert Einstein College of Medicine and director of the Spectrum Neuroscience and Treatment Institute. I guess the final point is maybe you could have one or two words of advice to the relatives of individuals with hoarders. What would you say to them?
I think it's very, very difficult. And I have a lot of people that say, well, my mother doesn't realize or doesn't notice that it's a problem. And it's so easy to get into an argument. I think the first thing is to remember this is a mental health condition. They're not deliberately being difficult or disruptive. Then, with kindness, try to get them assessed by a mental health professional, because as I've already indicated, there may be a whole range of things going on, and you need to get somebody assessed to make sure what any underlying conditions may be. But that can take a long time. If it gets to the point that you feel there is a danger to themselves or to others, you may have to call in the more legal aspects of it, and that's obviously a very, very hard thing for anybody to do. Could I just say as well, because I think this is important, that hoarding does occur at any age group. We've talked a lot because it tends to be old people that live alone, but you do see children that hoard, but that's often covered up by the parents dealing with it.
You know, it's interesting because in the same article that I was reading about Judd Apatow and his hoarding, he also talked about an experience that he had on ayahuasca, where he saw Jesus Christ, and he came to the understanding that our goal in life is to be kind to other people. And so you raised the issue of dealing with hoarders with kindness, and I think that's a good point to end on. So thanks very much, Lynne. Bye-bye.
Thank you for inviting me, Eric. Thank you.
It's been a pleasure.